Hello, my name is Christopher Aranibar. I'm an undergraduate senior at St. John's University working with CHIRP, the Collaborative Health Integration Research Program. Our team conducted 2 studies to investigate significant differences in the association of racial discrimination and healthy food consumption. Food consumption is a possible mediator between racial discrimination and negative health disparities such as heart disease, diabetes, and obesity. The aim of the study is to explore differences of discrimination subscales and investigate relationships to food consumption. The first study included 142 racially diverse patients and staff recruited from a community health clinic in New York City. The second study included 294 self-identifying Native Americans recruited by word of mouth and through community events. The participants completed a discrimination questionnaire and a food consumption questionnaire. They completed the brief perceived ethnic discrimination questionnaire, a 17-item measure that assesses different types of discrimination, including social exclusion and physical harassment and threat. The food consumption survey asked about unhealthy and healthy consumption over the past week. Health consumption items asked about fruits and vegetable consumption, among other health foods. The unhealthy consumption items asked about consumption of high fat or salty or fried foods, among other foods. Other potential variables that may affect food consumption or discrimination, such as marital status, gender, age, race, or education, were included as control variables. Our studies found significant relationships between discrimination and food consumption. There was a significant interaction between the samples and types of discrimination on food consumption. Specifically, a significant interaction of sample X race-related threat revealed that there was a positive association between race-related threat and healthy food consumption in the diverse sample, but not in the American Indian, Alaskan Native sample. Similarly, there was a significant interaction between race-related social exclusion and unhealthy food consumption. In the American Indian, Alaskan Native sample, race-related social exclusion was negatively related to healthy food consumption, although the effects did not reach significance. In contrast, for the diverse sample, there was a positive relation between social exclusion and healthy food consumption, although again, the effects did not reach significance. Overall, there were significant differences across the samples. Prior research suggests that baseline eating habits, for example, restrained versus unrestrained eating, influences whether social or physical threat increases or decreases consumption. For example, among unrestrained eaters, physical threat was associated with lower consumption. One possibility is that physical fear exerts a suppressive physiological effect. When the individual must respond to threat, the desire to eat is inhibited. Our studies suggest that local, cultural, regional factors may play a role in background characteristics that affect eating behavior or access to food. Cultural and regional factors may influence access to food and food preferences as well. Further, these background characteristics may also influence the foods that are preferred under stress, for example, between physical and or social threat. The level of background stressors could also influence susceptibility to acute stress effects on food. Limiting factors of the study include small sample sizes and reliance on self-report data. Further studies should be conducted across geographic regions to identify the other important factors related to location. Thank you very much. Have a good evening. Thank you.